Hello everyone and welcome to Watson Stay Healthy, and today we are going to talk about digestive health. With me and this moment we have a special guest. Please welcome Dr. Prabjot Singh Sidhu. He's the gastroenterologist who will be with here sharing with us talking about digestive health. Hello doctor.
Hi.
How are you doing?
I'm great, thank you.
All right, so everyone watching at home, so today as we are touching about digestive health, very straightforward. First things first, doctor, can you tell us what are the common health issues when we talk about digestive health?
I think in Malaysia as a whole, almost everybody's got some sort of digestive issue, and one of the commonest one is stomach pains or reflux, or otherwise people know as indigestion or GERD or GORD, whatever you call it.
Okay.
And the funny thing about it is that people, when they have chest pains, they run to a doctor. When they have gastro issues, they just think it's normal, and it's not.
Okay, all right. So there was a word that you mentioned, reflux.
Yes.
Can you go more detail about that?
Okay,
Sharing with us?
so what happens when you eat food or have a drink? It goes down, all the way down past here into your stomach.
Yeah.
Now, anything that goes from the stomach part back up, that is reflux.
Okay.
Now, normally we're all allowed to have some reflux, otherwise you couldn't have a soft drink and burp. You couldn't. But when that disrupts your life or causes problems, you have pain or all sorts of different other symptoms, vomiting, etc., that is gastroesophageal reflux disease, of which people know as GERD or GORD, and that is a problem.
All right. Okay. So, doctor, so talking about acid reflux, this is also a common symptom known as heartburn.
Yes.
Yeah. So, in your professional context, sharing with everyone here, what is heartburn and indigestion?
It's actually the same thing. Okay, heartburn, indigestion, reflux, GERD, it's all describing the same thing.
Also, it's the same.
It's exactly the same,
right.
but people understand it differently. The reason it's called heartburn because it's burning around the area of the heart.
Okay.
Reflux, as I said, it's going back up.
Okay.
Gastroesophageal reflux disease, GERD, is when it's causing a problem. But the pathology is pretty much the same. It's just we understand it in different terms, that's all.
All right, doctor. So, what causes heartburn and indigestion?
Okay, so this is a very big topic in itself, so I'm not going to bore you with all the details. Effectively, heartburn and reflux, indigestion is when things in your stomach crosses that valve, which we call the lower esophageal sphincter. Don't worry about the name. It's just getting past here, coming back up there. Now you have to think, what causes it to go beyond that point? Now, there are a whole host of different things. For example, if you got gastritis, or as people call it, gastric, you got inflammation, you generate gas, pressure builds up, things come back up. Women who are pregnant, puts pressure in the stomach, pushes things past the valve here, goes back up. People who are obese or low weight, it goes back up. It could also be a issue of the valve itself. The valve could be weak, or you could have something called a hiatus hernia, which is effectively a weakness at that one point. So anything that crosses that one point causes you to indigestion kind of thing. So the important thing is not about, oh, this is my symptom, here, take a medicine for it. It's obviously important to know the cause. You treat the cause, you solve the problem.
All right. Right, doctor, you mentioned about the causes. Now, as a person, what are the symptoms that we can actually see or feel when it comes to heartburn and indigestion?
Okay, so one of the first things is, as you said, heartburn, a burning sensation around the heart. Now, of course, when you get reflux or heartburn or indigestion, when it comes, not indigestion, when you get reflux coming up here, anything that moves from here up there can cause a symptom. Heartburn because it's crossing the heart. Of course, when it goes too high, you can get nausea, vomiting. Go even further, you can experience bad taste in your mouth, a sour taste.
Is it something like a pressure coming?
Some people have it because your esophagus, this valve is always closed, so nothing just comes out. But as things build up to push beyond it, you get a pressure sensation. Yes, you can get that. But some people even get issues with earaches, migraines, even sinus issues, which they never identify as being
related.
Exactly. And it's partly because it's going all the way up there. And we know for a fact also, people who have asthma have worse reflux or heartburn, and people with heartburn can make reflux worse because it goes up, overspills, and then the lung hyperinflates, puts more pressure, and goes round and round and round. So what I'm getting at, it's not just the heartburn or the warm feeling you get there. It could be earaches, migraines, asthma, all been set off by the same thing, which is not the first thing you think about.
Correct.
It's from there.
Yeah.
There you go.
So when you have these symptoms, what would be your best recommendation as a person? I mean, they might not know it's interrelated.
Of course, of course. So if you get this symptom once and it goes away and that's the end of it, fine. If you get maybe twice, you can try some over-the-counter medicines to see if it helps with it. We're talking about the heartburn sensation.
Yeah.
But anything beyond that, especially if you're above the age of 40, you have to go and see your doctor. Never downplay these things. Okay, I'm not trying to scare anybody, but it's always safer. If we would rather tell you there's nothing wrong than tell you, oh, it's too late. Of course, under the age of 40, the likelihood of anything serious is lower, so you can try some medicines perhaps for a week, and then if it's not settling, you must see your doctor. But never downplay these things. People often think, oh, it's my usual heartburn. No, there's no such thing as usual heartburn. It was never there before. Why is it acceptable now? It shouldn't be.
All right, doctor, how can we prevent heartburn and indigestion?
Okay, well, that's a very long list in itself, but if we focus about what's happening here in Malaysia, the commonest things is food, or actually the lack of food. They're not eating on time or not eating frequent enough. The second thing is stress. Stress produces lots of gastric acid. And the third thing, even though it's a very long list, I'm talking specifically about Malaysians, is the choice of medication. Certain painkillers or anti-inflammatory medicines or steroids can irritate the stomach. Now, if we come back to food, of course, we know spicy food irritates the stomach, causes more gastritis, reflux we get with that, but also sour food, which there goes a lot of our favorites, and also oily food will irritate the stomach lining. Now, that doesn't help with gastritis, leading again to reflux. Now, what's also interesting, we know our food in Malaysia is fantastic. It's all nice and fatty and very tasty, but fatty food as well as smoking relaxes that valve that we spoke about earlier. When that relaxes, anything from there comes back up, leading to indigestion reflux.
All right. So, doctor, you did mention about eating on time. Would you explain that more when someone, especially who wants to go through on perhaps dieting, they think by skipping meals would do? I mean,
okay. So the main thing with gastritis, as far as I see with my patients, is that you don't want an empty stomach. Keeping it full is what you want. Now, if you're on a diet is a funny thing, because actually the best way to lose weight, if that's what people want to do, is to eat more of the right food rather than cutting out things. Now, if you look at types of food and what it sits in your stomach, liquids stay there for about 30 to 40 minutes. It's out of the way. Vegetables stay there for 4 hours. Now, you want something to sit in your stomach better. Now, there's a lot of things you can talk about for diets, but that's a huge topic in itself. But with regards to what you should do to prevent gastritis, just eat. But eat the proper food, the right type of food, in the right frequency, and don't delay. If you're going to be running late because you have a meeting, grab a quick snack. Eat some nuts or something.
All right, doctor, when we have digestive disorder, when would be the best advice? What would be your best advice of seeking a visit to the doctor? Or
I guess the simplest way to put it is that you never had these symptoms before and you have it now. Why are you accepting the symptoms now? If anything has changed from your normal, whatever it may be, go and see a doctor. If we're talking about in particular context of indigestion and reflux, over-the-counter medicine once and you're 100% better, then maybe it's probably nothing. But anything beyond that, go and see a doctor, especially above the age of 40 where more serious things can happen. The thing is, and the fact does remain, is that we would much rather tell you there's nothing wrong than tell you, sorry, it's too late. So just ask. You lose nothing by asking.
All right. I mean, once again, thank you very much,
Thank you for having me.
Doctor, for joining us today with Watson Stay Healthy as we touch about digestive health. So thank you and see you again.